Tell me a little bit about the incredible work Aditya is doing, because I firmly believe empowered mothers create empowered daughters. Tell me something about what she's doing, and then we'd like to get a mic across to Aditya here, who's going to tell us a little bit. I promise not to put you in the spot, but just a little bit about what you're doing, because I think it's incredible. I mean, the same step that you've taken to go after something that's less talked about, and you've taken this as a mission to normalize it. It needs to be a normal conversation. Aditya is doing that in a similar way for a different issue.
So I'm actually really proud of what my daughter Aditya is doing. She's just launched an initiative called Ujas, which she's going to talk about more, and working in the space of menstrual health and hygiene. So it's something that I'm personally very, very proud of as a mom.
Would you like to tell us something about it?
Thank you. So Ujas is an initiative which works with menstrual health, hygiene and management, and we work with grassroots level organizations. We have 3 verticals under Ujas, which is awareness. So we create awareness with girls, with their families, with mothers. We have distribution, so making products more accessible and affordable for our beneficiaries. And we have sustainability, which we look at implementing sustainable measures of intervention so that girls can be self-sufficient and they don't have to rely on anything else or anyone else. And I truly believe that menstrual health is very much connected to women empowerment, and it's a basic human right. And I think that's what really led me to start Ujas.
You know, I also want to draw a link back into the lack of discussion and conversation on menstrual health, and how that directly has a bearing on the mental health of women. I mean, when I was growing up as a 12-year-old, if I had to go to buy menstrual supplies at a chemist, I had to ask for 5 things, and the 5th thing would be, sanitary pads. It shouldn't have to be that way. And unless and until men and women and mothers and fathers normalize conversation on menstrual health, it's not going to happen. So kudos to you, and kudos to you, Mrs. Birla, for raising a daughter like this, because we need to have these conversations.
Thank you. You're absolutely right, actually. And the statistics that she tells me are so appalling that we, over here, like in Bombay, for example, in our kind of houses, also, there's a lot of stigma. But of course, what she says and what happens at the grassroots level, at the rural level, is far worse and absolutely unthinkable. So I'm really happy that she's taken up this cause, and she's really doing it with a lot of, she's very passionate about it. And I'm sure that it's going to make a huge difference and huge impact. And like you very rightly said, that it has a direct bearing on the mental health as well of women.